देखो मैं आपको बताता हूँ कभी होल्ड द बेड बस होल्ड द बेड बस वेरी गुड कम टर्न ऑन माय साइड स्टॉप समझ में आया छोटा छोटा वीडियो लेना लंबा लंबा वीडियो नहीं लेना ओके स्टार्ट ब्रीथ इन ब्रीथ आउट नाइस कम पता चला टर्न करो यस हाँ बराबर है ओके दिस इज गुड अपना इधर दोनों पैर सीधा ब्रीथ ब्रीथ आउट यस बस सीधा होगा रिलैक्स लो ब्रीथ आउट सांस लो ब्रीथ आउट यू आर वेरी यंग तो इसमें कोई इशू नहीं है ओनली थिंग इज यू नीड टू वर्क अ लिटिल ऑन योर पोस्चर दैट्स द ओनली प्रॉब्लम सांस लो बाहर और ये 3 साल से जो प्रॉब्लम है ना इसकी वजह से तुम्हारा पोस्चर मतलब वो वैसे ही है उसमें कुछ करेक्शन नहीं हुआ है सांस लो वेरी नाइस सांस लो ब्रीथ आउट बस सेट रिलैक्स करो Relax. Good. बैठो. Relax. ये शोल्डर थोड़ा सा लूज है. रिलेटिवली ये थोड़ा सा एक्सरसाइज करो ना सारा रिलैक्स हाथ इधर रखो मेरे हाथ के ऊपर पीछे यस एल्बोस क्लोज रखो और मैं ना अभी पीछे जाऊंगा ऐसे ठीक है तो पूरा बॉडी वेट है ना मेरे ऊपर डाल दो और पैर को हिलाओ मत पैर उधर ही रहने दो ओके रिलैक्स करना है आपको कुछ नहीं करना है पूरा वजन मेरे ऊपर डाल देना है ऐसे ओके यस out breathe out nice breathe out nice very good nice okay come on your chin yes hand breathe out yes once again breathe out no breathe out yes good relax breathe once again breathe out once again breathe in breathe out good yes good turn on my side this side yes और थोड़ा yeah ankles closed दोनों पैर सीधा now bend only दोनों पैर सीधा कमर को ना थोड़ा सा मेरी तरफ लाइए नहीं ऐसे नहीं टर्न नहीं करना आगे रहना है बस आगे हाँ और आगे हाँ बस this is relax okay yeah breathe out yes nice hold the bed relax करो बिल्कुल पैर को relax करो bend this knee Good. Shift your breathe out. Perfect. Turn the center. Relax. Breathe. Breathe out. Once again, breathe. Breathe out. Very good. Okay. Relax. Okay. Relax. शोल्डर थोड़ा सा स्टिफ है. Relax, relax. I'll expect you to follow some exercises also. Benefit in the long run, because what we are doing is 50% of the therapy and 50% depends on the exercises. हाथ इधर रखिए जहाँ मैंने रखा है, ऊपर देखिए. Yes, relax करो shoulders को. हाँ, relax. Very good. Comfortable? Yes, very much. Nice. How does it feel? Better. Yeah. And this is okay. Very good. This side. All you need to do is get your chin backwards as much as possible. Breathe. Breathe out. Breathe out. Same once again. Breathe. Breathe out. Breathe out. Breathe out. This is painful.
Yeah.
This one. This is hip.
Yesterday's.
Good. बेड को पकड़ के रखना, ठीक है? Breathe. Breathe out. Breathe करो. Breathe out. Breathe. Breathe out. Relax. One area I have found a little bit of issues in the lumbar area, okay, which we have adjusted. और हमने एक एक्स्ट्रा मूवमेंट नी के लिए भी किया है. रिलैक्स करो. So your position is different in terms of your ankle. Because हल्का सा close and
Hello, my name is Nadeem Siddiqui and I happen to have 2 sessions with Dr. Sudarshan. This is my second session. The first session I had is 15 days earlier. I came with complaints of giddiness and a lot of imbalance and pain in various body parts. I had this session with full setting done by Dr. Sudarshan. I am so happy to tell you that Alhamdulillah, a lot of those symptoms have been resolved. There are flexibilities which I was not able to see earlier. Those flexibilities have returned. I am feeling very comfortable. This second session, Dr. Sudarshan asked me for various other issues on the knees, on the hips, and then he has set it up. So I am very hopeful that this second session also gives me very good results, inshallah. And I am really thankful to Dr. Sudarshan for a very good, caring nature. He is a very polite person, listens to your problems very well, and does a very good job. I would like to tell the masses that chiropractic therapy is a real therapy after my 15 days of experience, and you must consider chiropractor therapy. Specifically, Dr. Sudarshan, I am saying upfront because I have a clear experience with him. For your neck pain, for your shoulder pain, for back pain, for hip pain, for your knee pain, and for your body alignment issues and pains which are unexplained by the medical fraternity, pains which are unexplained despite you taking painkillers. So rather than going in those path of taking painkillers and damaging your stomach and your kidney and your other body parts with those side effects, I would recommend that you once at least consult Dr. Sudarshan. I am his patient, and this is the patient speak, and I think it will be nice that you at least get in touch with him for all your problems related to the muscles, joints and spine. Thank you very much, Dr. Sudarshan, and I wish you all the best if you contact Dr. Sudarshan for your therapy. Thank you.